So I'm going to break down the list of labs that I requested that my doctor ordered during my primary care appointment. So first is the triglycerides and HDL. And I'm really looking at that to calculate the triglyceride to HDL ratio. And that's a fantastic biomarker for heart health or cardiovascular health. And you can also use it as a surrogate for insulin resistance. So insulin is very important. It's a very important carrier for glucose. So whenever you eat something and it naturally has sugar in it, the body takes that sugar and then it transports it to the cells, the organs that need it the most, by way of insulin. And insulin is produced by the pancreas, and patients who have diabetes have insulin resistance. Their cells aren't recognizing the insulin, or their pancreas is not producing enough insulin. So with the triglyceride to HDL ratio, you can not only use it as a marker for cardiovascular health, but you also can use it as a surrogate for insulin resistance or insulin sensitivity if you don't have access to a different lab, which is the fasting insulin. The fasting glucose, so that fasting basically is not eating or drinking anything for 8 hours before you get the lab drawn. And with the fasting glucose, you're looking at your glucose levels before you've had anything to eat or drink. So this is just the glucose that is floating around in your system, or in your bloodstream, I should say. And a high fasting glucose is suggestive of insulin resistance, because technically if you have a high amount of, or an abnormal amount of glucose floating around in your blood and you have not had anything to eat or drink for at least 8 hours, then it could be a sign that your insulin is not able to carry that glucose to the cell, and the cell respond to it in the appropriate way, or your body is not making enough of the insulin in order to take that glucose out of the blood and then bring it to the cells that need it the most. So high fasting glucose is a sign of insulin resistance. And then I also ordered the fasting insulin. So a high fasting insulin is a sign of inflammation, but it can also be a sign of inadequate or compromised pancreatic function. Next, I ordered the CRP, or it's called a C-Reactive Protein, and that is an excellent marker of inflammation. And you'll see that with all of these labs, a lot of it has to do with inflammation, and chronic inflammation in the body really is the precursor for the development of multiple conditions, some of the most common conditions that we deal with, whether it is high blood pressure, heart disease, diabetes, and then, of course, obesity. Many cancers are linked to chronic inflammation within the body, and then just overall health and like how you feel on a day-to-day. So problems with sleeping, or problems with mental focus, problems with your overall energy state. So feeling fatigued, chronic pain, joint pain, a lot of it has to do with chronic inflammation. So you'll see that's a common theme. Your hemoglobin A1c, that is basically showing how your body has been dealing with sugar over the past 3 months. And then the uric acid, so that is a great biomarker again for inflammation, because if you are in a chronic inflammatory state, then you have a buildup of uric acid. It can build up in your joints and cause severe pain. It can also predispose you to kidney stones, which then affects your urinary tract. Liver enzymes, so that's your AST, ALT, GGT. Your liver is the primary source for metabolism, for breaking things down that you eat, drink, consume, or that you're exposed to. And so it is super important for that organ to be functioning at its highest. And so if your liver is not functioning properly, then your AST, ALT, GGT can be elevated. Vitamin D is important not only for your energy level, but for your bone health, for your neurologic health. And so being deficient in vitamin D can be a significant issue. And with the average American diet, or they also call it the SAD diet, which is the standard American diet, we oftentimes lack good vitamin D sources. And we also know that sunlight is a fantastic source for vitamin D, but with our typical workday, with most of us being stuck in the house, we're not getting enough vitamin D oftentimes. The complete metabolic panel, so that is looking at your key electrolytes, whether it's sodium, potassium, calcium, and then it's also looking at your kidney function, so your creatinine, your BUN. So that's why I just want to make sure that my kidneys are functioning at their peak. And then lastly is the complete blood count. And your complete blood count is a reflection of how well your bone marrow is doing with creating red blood cells, white blood cells, platelets, your being anemic. That can cause a multitude of issues within your body, particularly I think as Black women or women of reproductive age. What we deal with is anemia. Whether it is from heavy vaginal bleeding, from uterine fibroids, or a multitude of conditions that can affect the uterus and then result in heavy vaginal or abnormal uterine bleeding, pregnancy, which puts us in an anemic state, and some of us don't recover well from that. And then there are also various, blood conditions that can cause anemia. Your platelets are super important in allowing for your blood to clot appropriately, so that if you get a cut, that bleeding will stop quickly, and then that cut will be able to heal. And then high platelets can also be a indication of infection or inflammation. And then your white blood cell count, so your white blood cells help fight infection. They help keep your immune system strong so that whatever you are exposed to, your body can properly fight against. And so that is the list of labs that I requested. And again, a common theme is just evaluating inflammation, my overall energy state, my heart health, my bone health, my liver health, my kidney health, which are all super important organs to keep me healthy. So yeah.